Hi, my name is Sergeant Groner, and today I'm going to talk to you briefly about the two medications that are non-nicotine replacement therapy that the base offers for smoking cessation. The two drugs are Chantix and Zyban, and both of them are available here and in the market outside. Medication Chantix is used in combination with the Stop Smoking program. That medication generally helps better if you have a support group when you're trying to quit. Chantix works by blocking nicotine's actions in the brain and helps to decrease your smoking desire. The Chantix works mainly by blocking the brain's pleasurable responses. The brain has nicotine receptors in it. Nicotine attaches to these receptor sites with a chemical called dopamine is released into your brain. When Chantix attaches to those receptor sites, much less dopamine gets through and thereby actually makes you not enjoying the cigarettes. Sometimes Chantix can cause serious mental or mood changes. And the side effect side of it, even after stopping medications, drinking alcohol while on this medication may also increase the risk of that. And if you're on some kind of a medication like antidepressant or anti-anxiety meds, we don't really want to put you on Chantix unless the doctor who writes those prescriptions is aware of it. The common side effects of Chantix are nausea, headache, vomiting, drowsiness, and gas. Constipation, trouble sleeping, and unusual dreams are also associated with it. Recently, the FDA put a black box warning out for both Zyban and Chantix. Patients taking those drugs have reported unusual changes in their behavior, becoming depressed or had their depression worsen, and had some thoughts of suicide or dying. In many cases, the problems began shortly after starting the medication and ended when the medication was stopped. However, some people continue to have those symptoms even after stopping the medication. Also, in a few cases, the problems began after the medication was stopped. Okay, so here's the things you need to know. If you're taking Chantix and you're feeling bad, if you're feeling suicidal or homicidal, you just quit taking it. It's pretty smart. Then you let the pharmacy or the doctor know. It's generally not a problem for most people if you think about the fact that medications sometimes cause side effects and you know that going into them. Okay, so let's move on to Zyban. Zyban is an antidepressant medication that they found by accident worked well with smoking cessation. Zyban's history is interesting because smokers who happened to be using this as an antidepressant found that they didn't want to smoke anymore. And the success was so aggressive that the company actually renamed it Zyban and put it back on the market as a smoking aid. Zyban is unique because it has similar ingredients to the drug Wellbutrin. Therefore, it has the same antidepressant effects that you get, which means you feel fairly decent and fairly good and not so moody when you're trying to quit smoking. And although it is effective, we're not exactly sure why, and the reasons are still under investigation. But some hypothesis on that is it may work by restoring the natural balance to your neurotransmitters in your brain. Studies have shown that a small number of people who take antidepressants for this condition may experience new or worsening depression. Again, if you begin to feel more depressed or more aggressive, you just quit taking the drug and let the doctor or pharmacist know. Some of the most common side effects are dry mouth, trouble sleeping, and that usually just takes place while your body is getting used to the drug. If you have dizziness, drowsiness, nausea, or diarrhea, fatigue, constipation that go over a certain period of time, like a week, that would be something you'd want to quit taking the medication and talk to your doctor about. It has the same FDA black box warning as the Chantix does, so I won't repeat that here. But I will say how these medications kind of line up. Chantix is 80% of a success rate for quitting chewing and smoking if you take it for 90 days. Zyban is about 36% by itself and 55% if you add the nicotine patches to it. So you can take Zyban and nicotine patches and apply both of them together, and that combination has worked successfully for a long period of time because Zyban and patches were out prior to Chantix. But Chantix has a good success rate with quitting, and so does Zyban, depending on what's going on with you. The base also offers nicotine replacement therapy medications like nicotine patches, and sometimes, in certain cases, nicotine gum. These medications work by adding small amounts of nicotine to your body during the day, and it helps you to wean off of the actual chewing or smoking that you will be doing. Does anybody have any medication questions?
what is the black box warning that you talked about?
Well, black box warning means that the FDA has put a caution on that drug, meaning that a certain population can't take it for various reasons. So because of that black box warning, the pharmacy looks at your medication history to see what kind of medications you're actually on. And if you are already on an antidepressant or anti-anxiety medication, we would rather try you on a different product because I don't want to give you something that's going to cause you harm. Any other questions?
So Chantix blocks the nicotine and Zyban does what?
Zyban doesn't necessarily block the nicotine, but it has been shown to make your body want to smoke less by taking this medication on a regimen of two times a day.
Okay.
So I can't give you the neat chemical reasons why, it just does. And those reasons are still under investigation, but some of the theories are that it helps the body to put its neurotransmitters back to normal, so you don't have so much addiction factor to it. Any other questions?
The smokeless cigarettes, are they any good?
Smokeless cigarettes are not FDA approved, but what I will say is that they are nicotine replacement therapy concepts. You do take a certain amount of nicotine and smoke it per day, and it does give you the feel of the actual cigarette, but it doesn't actually help you with the behavioral changes you need to go through when you're smoking and trying to quit. So when you're trying to quit smoking, you need to actually stop doing the behavior, because if you do this behavior with nicotine replacement, you're not actually improving your situation, because you're still going to be smoking, and now you're just smoking the cigarette electronically instead of the actual stuff, and you pay more for that. So I'm against it, but it is out there. It does work for some people. It's just not the best one that I've seen. Any other questions? Okay, well, thank you again. Remember that the medications that I just mentioned are available here at Patrick Air Force Base. Feel free to talk to myself or the pharmacist about any of these drugs before we issue them to you. If you have any questions, you can get a hold of the pharmacy. Thank you.